Hello, my name is Corey Mickle. I'm a master's of public health student at Liberty University with a concentration in nutrition. I did my research on reducing food insecurity in the Richmond, Virginia area in collaboration with the SNAP program. So I also did my practicum at the Virginia Cooperative Extension off of Parent Road, which is collaborates with the SNAP, Virginia SNAP program as far as in reducing food insecurity. Next slide. Okay. So, food insecurity, or possessing inadequate resources to maintain a safe, nutritionally adequate diet to support an active and healthy life, has been an ongoing public health issue for many years. Approximately 41.2 million people, 12.3% of the population of all Americans, are food insecure and worry about getting enough food for their families. The overall dietary intake of the U.S. population is not ideal. The overwhelming majority do not meet the recommendations of the dietary guidelines of America. However, in many subgroups of the U.S. population, including those of low income communities, are more likely to be food insecure and have poor dietary intake and a heightened risk for chronic disease compared with the entire population. 1 out of 7 Americans goes to food pantries regularly for charitable food. A person's location, identity, and socioeconomic status compound or determine most of their experiences when it comes to food access. So people with the same income or who identify similarly, who live just a few miles apart, have dramatically different experiences with accessing foods. With this in mind, we seek to find ways to provide more nutrient-dense foods and educate individuals in these communities about healthier eating and availability. Next slide. The purpose of this research paper is to examine the impact of the Supplemental Nutrition Assistance Program on reducing food insecurity in low-income communities in Richmond, Virginia. As we stated, food insecurity is a major issue in the United States, particularly in low-income communities. In Richmond, particularly, 20.3% of city residents experience food insecurity. So, through collaboration of SNAP, which is a federal program that provides financial assistance to help low-income households purchase food. Let me see. So we decided to use a survey tool at these sites where the education was being done through collaboration with the program. And our survey tool just included just a simple and approachable in-depth survey, and it served as an instructional tool to help collect data for the study. The group took accessibility concerns, deliberate involvement, and survey weariness into account while designing this tool so that it would be enjoyed by those who are regularly may not have access regularly, as other individuals. Next slide. Excuse me. So conducting a needs assessment and reviewing the relevant research literature was an essential first step in understanding the issue of food insecurity in low-income communities in the current SNAP system. So this included a review of existing literature, an analysis of secondary data, primary data collection through surveys and interviews with key stakeholders such as SNAP beneficiaries, community leaders, and local food banks. The survey instrument included a range of questions which included access to food and fruit and vegetable consumption, home environmental factors, food shopping habits, and demographic traits. These demographic traits included age and years, gender, preferred language, residency status, greatest level of education gain, race, yearly household income. All of these were factors that were included in our survey instrument. Next slide. So the literature makes it abundantly evident that a variety of variables such as inadequate diet, a lack of physical exercise, and the environment contribute to a high incidence of obesity. So due to their living surroundings, residents of metropolitan areas tend to be more obese and have less access to healthier food options. These elements influence the behavior of these locals and are known to have a negative impact on obesity. So to promote the intake of healthy foods in urban and low income communities, it is also crucial to pay attention to the food environment. In underprivileged populations such as those in the city of Richmond, initiatives to reduce obesity must be based on access to nutritional foods such as fruits and vegetables. Next slide. Although neighborhood-specific policies goals differ, many in the area shared similar trends. Throughout the survey, one goal was to determine what was important between 17 different neighborhoods, which we narrowed down from 50 that were named throughout the survey. And where these neighborhoods where we felt that food access was felt to be most limited, and where they gave most feedback on food policies that they wanted to see selected. So although, like I stated, there were different policies, specific different goals that differed, throughout different neighborhoods. They all show, they all shared the same, pathways of putting these and different solutions for putting these into action. So they felt that working collaboratively with neighborhood agencies to enhance or modify current programs might help meet citizens' goals. Many encourage the consumption of healthier foods in schools and the government mandated facilities, accessibility to land and grow food, offering food in the classroom to students as well as salad bars. They also encourage those eligible for SNAP to sign up for the benefits and to increase local business participation by allow for better access to foods in those communities. To promote healthier eating and living as a comprehensive strategy for obesity reduction and prevention, there were several methods that were also adopted or being taken into consideration for implementation. These suggested tactics included nutrient and environmental audits of gas stations and grocery shops, a community garden, the in-store marketing program, and even a walking challenge for the entire town or community. Improvements to current walking pathways in collaboration with the local library. So some of these strategies encourage the development of new community collaborations that emphasize healthy eating and healthy living practices. So collectively, these measures to promote healthy eating and active living in extremely obese communities further support these programs and collaborations. So next slide, rather. Sorry. So recommendations. The current situation regarding food access, as I did my research, many felt was a result of systemic oppression, different redlining methods, and eventually the building of the I-95 freeway, which resulted in the creation of underprivileged neighborhoods, which have a history of deliberate setbacks and divisions. Resources and opportunities that are out of reach or inaccessible for these locals who need the most have been brought back to these regions through development. So additionally, targeted health programs that consider location accessibility and SNAP use could have the most benefits. Another recommendation is that SNAP's modest benefits are based on an outdated model and they average less than $1.40 per person. And this was dated back in 2019, so this may have changed. I wasn't able to find a number at this point. But as you can see, this is not enough for families to attain adequate amounts of food. So utilizing current connections with regional food suppliers to promote healthy choices through food pricing and marketing tactics at their venues is therefore the essential next step. And thank you, and this was the conclusion of my presentation.